Serving all of San Diego, this is your Fox 5 News.
Let's get you over to Raul with some good information now, Raul.
I'm getting information before we even start this. There are scores and scores of myths out there about what helps and what hinders the fertility process for both men and for women. Dr. Samuel Wood, now with the Reproductive Sciences Center, joins us now to help kind of sort the fact from fiction, which is very important. Dr. Wood, thank you for joining us this morning.
Thank you.
We have so much to get to, and this is really fascinating stuff. First up, let's talk about coffee and pregnancy, because you hear so much about, especially when women are pregnant, caffeine, no caffeine, you can have a little bit. What's the fact and fiction here?
There's a lot of controversy about this, but a study came out recently that I think maybe has given us a final answer. And what it's shown is kind of surprising. Even 1 cup of coffee, the amount of caffeine in 1 cup of coffee can reduce blood flow to the fetus by 25%. And of course, when blood flow is reduced, so are nutrients, so are oxygen, so is oxygen. And so in the end, you have smaller babies. They grow less well.
Wow. Does that include tea as well, or is it just for coffee?
Yeah, 1 cup of coffee is essentially the same as 2 cups of tea. Now, there is some caffeine also in chocolate, but it's much less. So I think it's only fair, a woman going through a pregnancy, she gets to have her chocolate.
So bottom line here with the coffee and the tea, is it a safer bet just to kind of lay off for the duration of the pregnancy?
If a woman can, that's the way to go. I recently worked with a woman. She drank 2 pots of coffee a day, and we're trying to get her down to 1 cup a day. But if you can completely stop it, obviously that's best for the baby.
Oh, okay, duly noted there. Now, as far as fertility, boxers are a better bet than briefs. True or false?
There's no doubt about that. The testes are 1 to 2 degrees lower than the body. If you actually had the testes in the body, it completely stops sperm production. So anything that increases heat in the area of the testes is going to create damage to the sperm and reduce the sperm count.
So if there are any problems, then switch over to boxers if you haven't already, just in case, to be on the safe side?
If you're trying to get pregnant, just use boxers.
Perfect. This kind of goes on the same lines, because you heard this as well. Laptop computers, you know they get really hot under, and most people, you see them with their laptops right there on their laps.
Yes.
What does that do? Same kind of thing.
It's very convenient to put the laptop on your lap, but it can increase the temperature in the scrotum to 103 degrees. Wow. So it can have a dramatic effect also on sperm counts.
And when it gets that high?
You got to put it on a desk, not leave it on your lap.
What if you put like a pillow on top? Does that make it worse, or does that do anything?
No, that's the other thing that you can do. You can put some sort of platform under it to avoid that.
Okay, good stuff. I'm taking all these notes right here. Okay, here's another one. If you want to get pregnant, order up some oysters. We have heard this is like an age-old one, the oysters. True?
Well, there are 2 aspects to this. One, oysters are felt to increase libido, and they may well do that because they increase testosterone levels in both men and women. But they also have a direct beneficial effect on sperm because they reduce the damage that's normally done to the sperm during the course of its production. So oysters, they absolutely do work.
Okay, so trying to get pregnant. So far I have boxers and oysters.
That's right. Wear boxers, eat oysters.
Wear boxers, eat oysters. Okay, this one, I don't know that I'd heard of this one, but cough medicine can help you get pregnant.
Well, it sounds a little strange, but when you cough, you're coughing up mucus.
Okay.
And so these kinds of medications, and here's one example, actually thin out the mucus. Now, mucus at the level of the cervix can either serve as a brick wall for sperm, or it can actually help guide the sperm in, a superhighway for sperm if you have good mucus. And so things like this can help.
Man, this is fascinating stuff here, Dr. Wood. Okay, you also like to blog about things. First up here, a question a lot of people want to know, is pregnancy safe after breast cancer? That's a good question.
Not only does it appear to be safe, this is what's going to surprise you. It may actually reduce the chance of having a recurrence. And so this is very exciting information over the last couple of years. So for many years, women feared it because of the association of estrogen and progesterone with breast cancer, but it may actually be helpful.
So just within the last couple of years?
Yes.
This was, wow. Okay, this one, fertility in the older male, because a lot of, you know, you hear a lot of older actors in their 70s are having kids. Anthony Quinn, I think, had a kid when he was like 81 years old. Is this kind of not true anymore? The older a man gets, the less his chances to have a child?
Well, a man that's 45 is like a woman who's 35. His fertility begins to fall. And especially over 45, the concern is not only reduction in fertility, it's been shown that there's association with higher rates of autism and perhaps schizophrenia in these older men. The interesting thing is you can actually test the sperm and you can determine which men are at higher risk for those problems. So it's not every man. Some men are perfectly fertile into their 70s, 80s, even 90s.
I wanted to get your thoughts on, because we know Celine Dion is pregnant with twins, and we know that I believe Kelly Preston, John Travolta's wife, 47 years old and pregnant. Is this something that's kind of the future with women being able to have children later on in life through the use of fertility treatments, or what's your take on that?
Absolutely. We have many women in their late 40s and now into their mid-50s. And if these women begin a pregnancy healthy, they do extremely well during the pregnancy. So I think it's wonderful that these women have a chance.
Okay, Dr. Samuel Wood, we thank you for your time. Fascinating stuff.
Thank you.
Appreciate you coming by. Okay, for more information, fox5sandiego.com. Shali?